Doctor, your free phone-in health consultation program. Every Friday from 10 to 11 a.m. brings you health and wellness.
If you're stressed out either at home or at work, or you're having a stressful relationship between either your girlfriend, your fiancé, or your wife, you can have erectile dysfunction.
Call in to get free consultation on health and wellness on 07000 917 917 and 090-256-25455. You can send in questions, cases, and related contributions on social media, Facebook, Twitter, and Instagram at WFM 917. Text and WhatsApp on 070-317-56537. You can listen live online at www.wfm917.com. Radio Doctor, Nigeria's first free consultation radio health program on WFM 91.7, the voice of women.
Good morning, good morning, good morning. It is 6 minutes after 10 this beautiful Friday morning. Thank God it's Friday, first of all. Also, it is the last working day of the month of January, of the first month of the year, of the first quarter of the year. So, I mean, plenty of things are happening today. That being said, don't be hard on yourself that, the month of January has ended. I did rubbish. I might not be talking to myself. I did rubbish in the month of January, which I did, health-wise, food-wise. But then that's why we have February. We can go again. We're not about that, we're dead, we're beating ourselves up. We're not doing that. We're not doing that at all. With that being said, I want to warmly welcome you to Women Radio 91.7 FM, the voice of women, Nigeria's first and only radio station for women and their families. This is Radio Doctor, your free health consultation program, where real doctors advise real people. Radio Doctor is Nigeria's first specialized health program where medical doctors consult for free and advise on your Women Radio 91.7. My name is Fumi Bangala, and our doctor for today is none other than the MD CEO of ROA Specialist Hospital, Dr. Abiola Ajayi. Good morning, Dr. Abiola. How are you this morning?
Good morning. I'm doing very well. And you?
I'm good. How's work? How's everything?
Fantastic. Couldn't be better.
Today we're going to be talking about fertility after cervical cancer. If you notice, there's been a theme, I think, in the last 3 weeks. Yes. So we're going to continue, in that line today. The phone lines will be open shortly for you to ask your questions. But this is still Women Radio 91.7 FM. 07000 917 917 is the number to call, or our toll-free line 0800 1235 917. You can text or WhatsApp us on 08155 917 917 or 0703 1756 537. We are live on YouTube at WFM 917, and you can listen to us on the go, www.wfm917.com. Now that is out of the way, let us get into it. Cervical cancer. Dr. Abiola, many women fear cervical cancer treatment means the end to their search, to their chances of having children. How true is this? And what should women know? Is it a myth? Is it a true? Is it a lie? What should women know, basically?
So, first of all, I want to just commend WFM and by extension myself that we continue on this topic, right? So we're talking about HPV, cervical cancer. Mm-hmm. We've already said that 95% of all cervical cancer is caused by HPV virus, and so this is just a continuation on it, and we're really treating this topic well.
So thank you. Well done to you too, and thank you for always coming.
Thank you. So women, they fear cervical cancer treatment because they feel like it's the end. That's the end of their chance to have children. But that is not always true. It's what you typically run into. So talking from clinical experience, you typically run into that because cervical cancer always presents, or not always, but often presents late. We talked about for early cervical cancer, there are no warning signs. So by the time a woman is bleeding, bleeding uncontrollably, or even has pain or anything like that, it's usually stage 3 or stage 4. There's 1 to 4 stages of cancer. 1 and 2 stage 1 and 2, usually the treatment will still allow the woman to have children on her own. Over half of them deliver naturally, and the other half may just need some assisted reproductive, but they can still carry that baby. But when we now talk about stage 3 and stage 4, and I know we'll get more in depth into this later, usually you may have some options that may end your fertility. So what is the moral of that story is that if you're screening, meaning testing for cervical cancer and HPV early, you catch these things early and you have a better chance of preserving your fertility for the future.
Okay. Before we go ahead, Abiola, you've seen Casper the Friendly Ghost, right?
Yes.
That's what I like. I think maybe clean the lens of your camera or something, because like I could hardly see you.
She says my pictures are dusty. Why don't I clean my lens? And I never remember.
And are you sitting behind? Are you sitting behind the light, or are you facing the lights?
The lights above.
Oh, okay.
Let's see. Is that any better?
Ish. I'm wondering why it's not as clear. Do you know what? Let me just go. Because this is not how it was last week. Did you do something different this week that's different to what you did last week?
Exactly. I'm in the same studio. I'm in the same chair. Everything's the same.
Huh. Okay. Yeah, all right. Okay. It was. I'm sorry. Like that's what the Friendly Ghost was the only thing I could use as. Oh my. Okay. We've talked about cervical cancer, HPV, and all of that. But can you tell us how, like, is it because, you talked about this last week, is it because the cancer is breaking down or eating the organs that is affecting fertility? Or, because you talked about stage 1 and stage 2 and how she can still sort of like be pregnant. But what happens, can you take us through what really, really happens when a person, like, how it affects fertility?
I'll make it simple. So we have, for fertility, women have hormones. You have your ovaries that have the eggs. You have fallopian tubes that carry the eggs to the uterus. Mm-hmm. You have the uterus or the womb. And then you have something that controls access to the womb called the cervix. So the cervix can open and close to allow things in and out. So when you're treating early disease like stage 1 and early stage 2, it's only affecting part of the cervix. So you can actually remove that part of the cervix that is affected with cancer. And you can oftentimes, 70% of the time, you can retain enough of your cervical tissue, your cervical mass, to have normal function. So that person will just have, for example, if you have an apple and you took a chunk out of the apple, it still pretty much looks like an apple, right? So the cervix, you just take a chunk out of it, it's still going to pretty much work like a cervix. So that's, and you still cured the cancer because you removed all of it, right? So if let's jump to stage 4. Stage 4, when you're looking at the cervix, it doesn't look like an apple. It doesn't look like a cervix anymore. It looks like somebody has eaten from all different sides of it. It's hard to even recognize. And when you want to now cut out all the cancer, if it has not spread outside the cervix, you have to remove the whole cervix. And oftentimes by then, it has started eating into the womb. So you have to remove the womb as well, or the uterus as well, which is what really affects fertility, is when it involves us having to do a hysterectomy or removal of the uterus.
Right. Okay.
In some cases, when you do surgery on the cervix, so you're trying to remove part of it. If you end up with scar tissue and the hole there closes up, it can also affect fertility, but you can repair that with surgery down the road.
Now we hear a lot of we did. We often hear a lot of young women say, "Oh, I can't get pregnant after cancer." I think that or it could even be a man, or I can't get a woman pregnant after I've gotten better from prostate cancer. Is this always the case?
So with prostate cancer too, it matters what treatment you took. By the time you do surgery on the prostate, most men suffer from something called retrograde ejaculation, meaning that when they're having sex, they can orgasm, they'll climax, but when they ejaculate, the semen and the sperm do not come out of the penis. They actually go backwards into the bladder.
Oh, okay.
And so the next time you urinate, everything will just come out. You won't even really notice it. But of course, if the sperm goes into the bladder, it's not going to where it needs to go. So that's how prostate can usually affect. It can usually affect fertility. Or if you do something called a prostatectomy, meaning remove the entire prostate, then you won't have any seminal fluid. It could affect fertility. But the good news is that you can go to the scrotum, go to the testicle, and get sperm from the testicle and use that for IVF in some cases. But if you're just saying naturally, just a man and a woman in a bedroom, if you've touched the prostate, meaning with surgery, whether it's laparoscopic, meaning camera surgery, or it's open surgery, oftentimes that retrograde ejaculation will cause men not to be able to father children.
But what about for the woman? If she has, she's been cleared, she doesn't have cancer anymore, she can still get pregnant, right?
She can still get pregnant, yes, especially if her cervix as long as her cervix is intact, meaning, the whole and the general structure is fine, even if it's missing a piece. And as long as the uterus is there, then she can still have children. And if you had a man and wife that had cervical cancer, early stage, prostate cancer, early stage, and they were both treated, more than likely you do IVF to take sperm from the man's testicle, test tube, and then now into the female. And then she could carry the baby to term and deliver naturally.
And I know we keep on is in Yoruba. I wanted to say this thing. Aman tenumo, early detection of cervical cancer. How does this influence a woman's ability? It might sound like, oh, you guys talk about this too much, but I mean, we cannot overemphasize it. How does
speaking about it, but it's very, very important.
Very important. So how? Yeah. How does
it's the foundation of everything. If you want to preserve your fertility, early detection is the key. And I always tell patients this: cancer nowadays, or the cancer diagnosis, is not a death sentence. It doesn't have to be a death sentence, especially if you catch it early and you treat it aggressively at the beginning. Then you can live a normal life afterwards. But our main problem is that you're speaking Yoruba, hello magic. We do these kind of things. We ignore our normal screening dates, so we don't go to the doctor until everything else is diarrhea. Everything is just right, and we're just running up and down. That we see that too often, and that's why the outcomes don't look as good as they should.
Right, and you talk about. You talk about stage 1 and stage 2, right? When a woman is undergoing surgery, she's able to carry out pregnancy. That's if the cervix wasn't touched or if part of the cervix wasn't touched. Right, that's what you said.
Yes. So she can still have, get pregnant as long as the majority of the cervix is intact and the uterus was not, the womb was not removed.
Yeah, but the question I have to that is, how is that possible? Especially if the drugs that she's taken, or that's if she's going through chemotherapy or post-care surgery, isn't it counterproductive with pregnancy? Because typically they tell you that when you're pregnant, there's certain things that you should not take, certain things you cannot do. So how is she able to, are there things that she has to do? How is she able to still be pregnant and the pregnancy comes to... Like the baby comes out. Yeah.
I understand what you're saying. So I'll go into a little bit more detail.
Okay.
So for example, now, if somebody has, cervical cancer diagnosis, they've done one of the multiple procedures to remove part of the cervix, but they still have a womb and they still have some cervix. Even if they remove almost all of the cervix, you can get pregnant, and they'll use a special type of stitch, a cerclage, to reinforce the cervix through pregnancy, right? So you put that stitch early on. Sometimes I do it at 12 weeks. Sometimes I do it around 18 weeks. But you put that stitch, and then when the patient's about 36, 37 weeks before they go into labor, you remove the stitch, or you're doing a CS, right? If you have any kind of surgical procedure on your cervix, I usually tell women 6 to 12 months before you now think about getting pregnant, so that everything there can heal properly. You mentioned radiation and or chemotherapy, which is important to note. You typically use that for advanced disease, so we're talking about typically use that for stage 3 and stage 4 cancers. There are still some of those people that can have children, but if you undergo radiation, radiation will directly affect your ovary. Very similar. So for that, the waiting period is 1 to 2 years. So 1 to 2 years after you've had radiation or chemo, usually the effects would have gone down by then. So those are excellent point. You're going to have to assist these women, but it's still possible.
Right. Do you know, I thought that a cerclage was only for women with incompetent cervixes who had probably gone through back-to-back miscarriages, but I didn't know that this could also happen with cancer survivors. Okay. Color
Yeah,
me.
so the term incompetent cervix, that's very good that you use that term. It just means that the cervix is not working the way it's meant to work. Mm-hmm. Yes, it's not. It doesn't open, close, and keep things in and out like it was designed to do. So we now use a stitch to reinforce that. You know that.
Okay. Can you walk us through the different treatment options for cervical cancer and how each one may affect fertility? You've already said it's that radiation, that one's going to affect the ovaries straight on. Wait, so are there success cases even with radiation? Before you answer my first question.
So say that the question again. Are there
success cases even with radiation of women who got pregnant with radiation? Because you mentioned that radiation affects the ovaries.
Yeah, so 100%. There are some. I'm not. Don't let me use the word 100%. It's still all bears down to the severity of the disease. So radiation is not standard. Everybody with cervical cancer doesn't get the same amount of radiation.
Right.
Radiation is calculated based on what they call tumor volume, or how much cancer there physically is. So if you had, for example, somebody with a smaller tumor volume that underwent radiation maybe for 6 weeks and responded well, cancer's in remission, those candidates would have a better chance of having, successful childbirth in future. But if you have, stage 4 can look different ways. If you have stage 4 that the cervix has been eaten up, the womb has been eaten up, it's spread to the bones of the pelvis, you're now seeing some spots on the liver, it's going to be a lot more challenging for someone like that because the anatomy has been distorted so much.
Right. Now to my question, what was the question? Yes. The treatments, is there a way to minimize or mitigate the risk during treatment to be able to still preserve fertility?
Yeah. So I know some of the common treatments, like surgical treatments, there's something called a LEAP procedures, like uses a laser, and there's something called a cone procedure. Both of those procedures were removing part of the cervix. They have minimal effect, and fertility is usually preserved. Right? So usually, over 70% of those women can have natural childbirth. There's something called a trachelectomy, which is removing of the cervix completely, but the uterus was spared, so you didn't touch the uterus. And with those, pregnancy is still possible. That's one of the ones where we use a stitch to reinforce that area where the cervix was. So those are let's say the first two simpler type of treatment where you can still get pregnant. If the uterus is involved and you have to do something called a hysterectomy, where you remove the uterus, that's where the baby grows. Obviously, pregnancy is no longer possible in that situation. And when you're using chemo, and I'm going in order, right, of most successful to least successful. chemotherapy, chemotherapy can temporarily influence your fertility, but once you stop the chemo, 1 to 2 years later, you should be able to get pregnant if everything else is the same. And then the final one, I would say probably radiation, or the final two. Radiation has your highest risk of infertility because sometimes the side effects of radiation are there for permanently or take a very, very long time to go away. And then in some cases, we do chemo and radiation in the same patient, and that's our worst case, meaning the least chance of somebody being able to preserve their fertility. So your treatment choice matters greatly, and let's keep saying it, and what drives which treatment choice you have to choose is how early did you catch the cancer. So screening comes back to the forefront.
Right. We're not really
clear.
Pardon?
I hope that was simple enough.
It was. I'm just like, like you have the solution to all these questions we're asking is once you do early detection, then you should be fine. Either ways. But then for women who we're not an egg freezing society. So you hear about women who want to preserve their eggs, not even because they're sick or anything. You hear about young girls as well who are selling their eggs, or women who don't have viable eggs. But should women consider freezing their eggs before treatment? If they do, or if you're saying yes, how effective is this? Who should consider it? Also bearing in mind the oil that is involved in these sort of things.
So the short answer is yes, women should consider freezing of eggs. I've gone through this scenario, and you're right. In the U.S., we talk about this stuff all the time. But in Nigeria, I've had maybe one patient in the whole time I've been here that has opted to freeze eggs. And I've really discussed it with a few. I always throw the option out there, but the cost is so astronomical. And when you freeze eggs, it works best for women that are under age 35. So, and you're meant to discuss it immediately after diagnosis. So let's say you have somebody that's 30, I told you I have a woman that's 31 with advanced cervical cancer, right? You have a woman that's 30 something. You now diagnose her with cervical cancer. In that same visit, I'm going to start talking about eggs and egg freezing, and at least give them the option, right? It gives you a future option of either doing IVF yourself as the patient or surrogacy. You talked about women selling their eggs, but there's also surrogates that will carry your pregnancy for you. If your doctor is recommending chemo, radiation, or both, you should really definitely consider, because that's when your fertility drops significantly, like we talked about in the last segment. It's becoming available in Nigeria. It's still limited, but there are a few centers that can do it. I always worry secretly in the back of my head about power. We don't have constant power, and this is not like a loaf of bread you froze in the freezer that can thaw and come back. And, the temperature has to be carefully controlled within just a few degrees and needs to stay like that. It can stay like that for years. You freeze it at 31 and you want to now have a child at 36. That embryo, that egg has been frozen for 5 years. And you have a continuous cost, whether it's yearly or monthly, you're paying. And you're just praying that the eggs were stored well.
Is it because of the cost of keeping them is it the keeping them that makes it expensive?
Yes. So it's the cost that makes it very expensive, because they're not kept in a typical freezer. So when I say freezing eggs, it's not like a kitchen freezer. These things often use liquid nitrogen. They're large vats, they're climate controlled, they're bacteria controlled, there's so many different systems. And when you don't have a lot of people doing something, you lose the chance for economies of scale. Meaning, if I have 100,000 women that want to freeze their eggs, I can charge each one of them a smaller amount than if I have 5 people that want to freeze their eggs. And since we have so few people taking that option, the cost is extremely expensive. I wouldn't doubt that if for a 5-year period you'd be in the tens of millions. I wouldn't doubt that.
But just to circle back, a woman can still conceive naturally even after cancer treatment, right?
Yes, even after cancer treatment. It just depends on which one and how strong the treatment was.
And how strong the treatment was. Okay. And you mentioned as well that a woman can wait a year, 2 years after the treatment to start trying to conceive, right?
Yeah, so if you had just basic cervical surgery, 6 to 12 months is the average. If you've had radiation and or chemo, it's 1 to 2 years. So you're just waiting for your ovarian function to return to normal. And it's typically 1 to 2 years. The research, we follow some of these women that have had cervical cancer, and they show that in most cases, women are able to have 1 to 2 children post-treatment. But the full recovery varies individual to individual. But oftentimes you see waiting the 1 to 2 years after treatment, they're still able to have 1 to 2 children.
And again, like we said last week, the issue is if somebody comes and then you say, oh no, you can still have a baby. The issue is if the person who's had the babies after would be willing to tell them that, oh yeah, I did have cancer, I have children after, because we're not about that at all. Abby?
Unfortunately.
Yeah.
Unfortunately,
okay. Okay, so are there how long should a woman I've asked that question. Many women feel guilt or shame after fertility struggles after cancer, because Nigeria is not nice to women who do not have children. Actually, Nigeria is not nice to women, period. But then when they're now like specifics, are you married? You're not married after 30, there's something wrong with you, they're not kind to you. You're not now married after 40, there's extra something wrong with you. You do not have children after 25 and you're married. In fact, the society will take a woman who's had kids and is not married and a woman who's been married for 10 years and doesn't have kids. It's like, you can't win this way, you can win this way. Yeah. But what's the advice you give to women who feel guilty or who feel shame from fertility, about their fertility struggles because they've had cancer or they've been able to go through cancer and they are better now?
You kind of hit the nail on the head there, where in Nigeria, the stigma of saying, oh, I had or I have cervical cancer is what a lot of what delays treatment or delays screening. So before somebody, wants to go and, just screen themselves for cervical cancer, they think, well, what if somebody finds out I have cervical cancer, right? If somebody is bleeding or spotting when they're not supposed to be spotting, oh, what if it is cancer? I better not go to the doctor and find out. Mm-hmm. I don't want people. I wish it wasn't so, but it is like that. And it's just going to take us repeating the message, trying to remove the shame, reinforce that people seek help early. I would tell women that infertility after cancer is a medical treatment, is not a personal failure. You did not cause your body to have cancer. It is extremely common. 600,000 cases is going to be diagnosed this year alone. This is not something that you're doing on your own or that you wished for or you ate the wrong thing. I get that question all the time. What did I eat to cause this? Or it's not much of that. It's something that happens medical, and we need a medical treatment. And the best thing we can do as medical professionals and family members is support that person's mental health. Let them feel free to discuss not only their symptoms, but their side effects.
I think that generally our brain tries to justify maybe a failing or something happened. Your brain needs a reason to hold on to say this is why this thing happened. So for instance, if a woman is dealing with infertility, she translates it as her body failing her. How much more when she has, I think even for cancer, I'm sure they think, oh my God, like what you said, oh, what did I eat? Is it what I eat that caused my body to fail me? You now take that and add infertility to it. I don't think it's It's unfair. That's how I can put it. And unfortunately, that's where family members and support, the people that you have around you, they play even an important role. But then we also still see partners, family members that do not support, or what's wrong with you? How can families play a bigger role when a woman faces infertility post cancer? What should they do? Because the husband can say, "Oh no, my wife, we're not stressing," but then his mom comes.
Yes,
Or his
grandma's
sister
around.
comes. Like, how does that woman navigate that? What is the advice you give even to family members? I know it might sound like, it might sound easier said than done, because these things have been ingrained into the fabric of our culture since. So somebody who is not just going to wake up and say, "I'm not going to abuse my sister-in-law for not giving us the children. It doesn't matter that she had cancer," and what. But yeah, maybe I'm going into a mini rant. Who knows? What would you say? Like, how can families and spouses especially play a much bigger role in helping, their wives when it comes to infertility after cancer?
Yeah, these are excellent questions, and it's easier for me to answer them with clinical experience now. What do I see on a daily basis? And I've mentioned this before on a previous show, but when I encourage the couples to attend clinic visits together. So I don't like seeing just a woman by herself going through the cervical cancer or any kind of cancer journey on their own. Number one, if they're going through it on their own, the outcomes are worse. Somebody that does not have any interpersonal support usually does not do as well as others that have support. One interesting thing I've started to notice, I look at body language when the couples come in. Because I have two chairs in front of my desk and I'm sitting on the other side. When I see a man sit down like this and a woman sit down like this, okay, it's a bit neutral. The man is leaning in the chair all the way away. I can usually tell that he's disinterested in the treatment and is not really wanting to support this woman. When I see him tilting, I promise you, it's almost 90 to 100%. When I see him, body language leaning over towards his spouse, if they're holding hands or touching, I know this couple is going to do very well. The woman is going to do very well compared to others with her same condition. So that's even just that small makes a huge difference. And you see the differences in how they respond to treatment, how quickly they get better, how soon they get pregnant again if they're trying to get pregnant, and just everything is better when you have support, and that extends. So if the couple can now do joint decision making, let's feel like it's joint. Baby, what do you want to do? Oh, this is what I encourage them to talk amongst themselves. Just builds rapport around this condition, and it always helps. The more understanding and support you have from those around you.
This is just an aside, because I find it very interesting if the man is on the other side, like he's the one who's had, like in the case that we said earlier, I know you know where I'm going to, but I'm just going to say it. If the man he's been treated for prostate cancer, I find that women are more sympathetic to men than men are to women. Men do better. That's what I'm saying.
God bless you for noticing that. I love studying human behavior. So if I go out, if I don't go out with my people, I go out by myself and I just watch people. I watch how they interact. I like doing that. So when you have a man with a wife that has a prostate cancer diagnosis, I see the woman will start crying. She'll put her hands on him. She'll hold his hand. It's going to be all right. I see that more often than not. When the roles are reversed, yes, we men need to do much better, because you should have, don't worry, you will deal with it, or they're just trying to distance themselves from the disease, and that's the worst thing you can do for your partner. So I know generally women are supposed to be more nurturing and caring, but if you have a partner, you need to support. You need to put all that stuff aside and just look at them. Imagine what they're going through. Imagine getting a diagnosis. I tell my staff this. I said, this woman has cancer. Why would you leave her sitting here. Be sensitive. We should have empathy for what our patients are going through. And if we as professionals need to do that, what do you think your spouse needs to do? Times 10.
I actually find the statement women are more nurturing very, very dangerous because it puts so much responsibility on women and absolves men of a lot of responsibility. Because what do you mean women are more nurturing when it has to do with your wife, who you professed, you chased her for her to marry, to be your girlfriend, you begged her with everything, use your family members to beg her. It went down on one knee, begged her, promised her heaven and earth, and then when a challenging situation comes, you want to distance yourself. Okay, Doc, let me ask you my next question, because are there any lifestyle or health habits that can improve fertility outcomes after cervical cancer treatment? I'm asking that because, when you had said, or someone will ask, health even more seriously or just continue how they were, does that reduce anything? What does that do for them, actually, if they now still want to have kids, or they didn't have kids before and they now want to have kids?
So I'm a really and you'll hear me talk about it, and I've been talking more about it the last 3 years, a component about nutrition and diet and lifestyle. Like, what do you do besides us blaming environmental factors? What do you do as a human to maintain your health and really treat diseases? A lot of what we go through, we can improve with changes in our diet. So if nowadays, if somebody asks me that question, if you have a cancer diagnosis, there are lots of research show that fasting, prolonged fasting, for some periods of time, of course, check with your doctor before you go on a prolonged fast. But what I'm saying prolonged, maybe 2 days, 2 to 3 days. When you start going into over 24 hours of fasting, your body goes into something called autophagy, where your immune cells will go around eating up cancer cells, eating up dead tissue, eating up necrotic tissue. And I would now, yes, your body does that, but it does it in a faster speed after a period of fasting. You're still drinking water, you can still drink water and things like that during, but from food. I will now also talk about trying to eat natural food. So you want to run away from processed foods. If you look at it, how do you tell? If you look at an ingredient list and it says something other than salt, water, and the ingredient like tomato or something like that, more than likely it's heavily processed. If you see words that you cannot pronounce, like sodium benzoate or maltodextrose or high fructose corn syrup, anything that sounds strange or is difficult to pronounce, some of those things are known carcinogens, meaning we know that in lab animals they can cause cancer, and in some cases they can cause cancer in humans. So all natural. I don't do things crazy like just eat only fruits or things like that, but all natural, of course, reduce sugar and carbohydrates, basically protein, vegetables, and berries, fruits and berries. They have a lot of antioxidants, and those support your immune system. So, yeah, there are some things you can do to make your recovery better. Fertility is affected by diet. I have some testimonials on our social media where I treated women with infertility just by diet alone, and they are pregnant today. So, especially in cases of PCOS. So, is nutrition and diet important? By all means, it is. Very much so.
I didn't know that about intermittent fasting. Well, fasting, I just chose to call it intermittent fasting. And so that's why they say it's really, really good. February is me and you. God we read, because I know that intermittent fasting works for me. And I know, because the thing is, we've been trained to eat breakfast, lunch, and dinner. And what I've come to see is most times we're doing breakfast, lunch, and dinner, but you're eating lunch on top of food that's not even digested. Say, for instance, I don't think anybody's really eating breakfast at 7 o'clock, if we're going to be honest. Most people get to the office are eating maybe their breakfast by make me 9, 10. And then 1 o'clock, you want to eat again. And I'm thinking, and then on your way home, 5 o'clock or 6 o'clock, you want to eat dinner maybe before you get home or something like that. And I realized I was just piling food on top of each other, and your gut isn't healing. So I know that intermittent fasting works for me. So I don't even eat 3 square meals normally. But I need to start Yeah, we're going this. So please, who's going to join me? We're going to do February challenge of eating maybe twice a day. We eat our first meal by 12, and the next one maybe by 6. It's
I'll join you.
not you just we should maybe not
Sure,
processed
I'll join you.
processed food though. Like we're going to try. I can't believe what I'm doing, but
I get
yes.
into processed food too. I'll avoid all processed foods.
Let's start. Yes, no processed foods, no soda, no junk food, no junk food. Let's see how it goes.
Yes, no, that should be the first one.
Let's see how it goes. Let's see how it goes. Thank you so much, Doctor. But
My absolute pleasure.
finally, what would you say? What'd you say? Did you say something?
No, it's my pleasure. I'm ready for you. I'm listening.
Okay. Are there exciting new research or treatments that can give women hope besides egg freezing or surrogacy? Are there other ones that women can hold on to and be like, okay, yes, maybe there's still hope for me to still have a baby after cancer?
I wouldn't call them completely new, but we are always streamlining or improving our existing treatment. For example, chemotherapy works by killing cancer cells, but it also kills normal cells too. You just hope that you kill the cancer cells before you kill the patient. But we're experimenting with targeted chemotherapy, which would have less ovarian damage to maintain fertility and less damage to normal cells, where the chemo agents would really affect cancer cells more than. So we're working towards that. There are, with radiation, we talk about radiation be quite damaging to fertility. We have precision radiation, where instead of a wide field of the radiation, what we call wide cone, to have some that you can target the cervix or that area through the skin in a smaller area. Smaller area that's radiated, less side effects, less chance of ovarian damage. And we talk about freezing of eggs. Those techniques, as they improve, it becomes cheaper and available to more women. And the HPV vaccine is constantly being redesigned and updated every year, which is very useful. HPV is primarily what causes cervical cancer. So, and we can see with research that globally, where we have embraced screening and early testing, you can see that the death rate from cervical cancer is really plummeting.
All right. Thank you so much, Dr. Abiola. In your final words, pardon? Can you hear me? Dr.
Yeah, I can hear you very well.
Yeah, okay. So what final advice would you give to women diagnosed with cervical cancer today who are worried about having children in the future? Hi, Dr. Abiola.
Yes, the office keeps calling. I don't know why they would call me when I'm on the radio, but I'll deal with them. So,
right. Okay.
I tell women, don't panic. Don't ignore the fat chance that you need to screen. Remember, we've been saying that you should be screening yourself usually from age 21 every 3 to 5 years. So, I would advise women before starting any treatment.
So sorry, Dr.
Yes, it's a new. I have new CSOs, and they don't know that I'm on radio. I'm going to really deal with this. This will never happen again.
Right.
So I would tell women, always ask about fertility before starting any treatment. And I have some women like that. If they want to treat them for malaria, they'll say, "Hey, will this affect me getting pregnant?" No, or yes, or which is fine. Ask questions. I don't mind if people ask questions. And I like to end with the one that early detection saves both lives and fertility. And you cannot do early detection without screening or testing. Come in and get screening. I like giveaways. I'll screen the first 10 women for cervical cancer that reach out on social media or call me directly. We need to get the word out that this doesn't have to be a death sentence. There's hope.
Yeah. Thank you for always coming with gifts, bearing gifts for us to us. I would tell my friends and my colleagues that we should go and get ourselves tested. As interestingly, somebody asked me how do we calculate engagement on Radio Doctor, and I said, oh, they used to go and collect free gifts at ROA. He was like, really? I said, they would not call, but they will go. So yes, the first free 10 people, Dr. Abiola has been so gracious to give us gifts for cervical cancer to get yourself screened. So let's go, let's do it. Thank you so much, Dr. Abiola, for coming on to this edition, the last edition for the month of January, actually. And it was, I think, for the better part of this month, we talked about HPV and cervical cancer. So I look forward to what we're going to be talking about next month. Dr. Abiola is the MD CEO of ROA Specialist Hospital, and he was our free doctor. He was our doctor for the free consultation, not free doctor for the free consultation this morning, speaking about fertility after cervical cancer. If you want to speak to Dr. Abiola, 0913 579 5108 is the number to call, or 080 888-62635. And then you can check him out on social media, ROA Specialist Hospital. Once again, thank you so much, Dr. Abiola, for coming on the show today.
My pleasure. See you in February.
See you in February. Happy New Month in advance. Yes. To our Radio Doctor family, a happy New Month in advance. Make sure you do the best to be healthy. Maybe you want to join me on this February intermittent fasting challenge. Who knows? No processed food, no junk. Let's see. Let's hold each other's hands. Send a message, say if you're going to join me. Okay? Many thanks to the producer, Aisha Sonic. Many thanks to Miriam, to Benjamin in the studio, to Michael as well in the studio, for holding it down, and to our executive producer, Tonwo Kewale Shonaya. Many thanks to you. My name is Fumi Bangala. Do have a healthy day, and we look forward to an even healthier February, God willing. This is the Women Radio Day, so amazing shows for you to stick around with. Great music to also set the tone for the weekend as you get into February. Bye for now. God bless.